Hello, my friends. How are you? How are you? How are you? I hope you're doing fine. Okay, I'm still Ekwele Kalista Chidima, a certified medical practitioner and a fertility counselor as well. Okay, I'm about to treat this topic, which is natural process of conception. Okay, it's a complex and a beautiful dance of biology and timing. Here is step by step of conception we must know, and this breakdown is a natural mechanism of conception. Okay, in treating or talking about natural way of conception, there are so many ways of conception. An easy one, affordable one, time saving one. Do you understand? So at this point, we have to go through ovulation. There are certain things you need to understand at this point. You need to understand what ovulation is. I pinned ovulation. We must understand what it is. We must understand what fertile window is. We have to understand again the sperm transport. We have to talk about the ascending transport to that uterus, which is still the sperm transport to this, the mechanism at which those things happen, these transportations, this movement of sperm to the uterus or to the ovaries. Okay, we have to talk about fertilization process. These are the things you need to understand. We also need to talk about the implantation as well. There are a lot of things we need to understand in these factors I'm mentioning. And then we have to talk about factors that enhances conception. Maybe I will treat it in the next topic. Okay, now we have to talk about this natural process, which number one is ovulation. Ovulation, we must understand, is egg release. It's something that happens in every woman's life. Every month, a woman ovaries releases a matured egg, a process which we call ovulation medically. So again, it usually happens in the middle of the menstrual cycle. You need to understand how to calculate your ovulation. You need to understand the things you need to take up, or the processes you need to adhere to, or the feeding you need to put up to in order to get your ovulations intact, in order to see that the release of egg is maintained, that every month you release this egg and it gives you what you want at the point you want to use it. Okay, in all this, we have to talk about fertile window. Okay, but before then, let me put a little tips on this ovulation of egg. There are several things you need to take in order for your ovulation to be released, for you to be able to see it or be able to have that conception. So moving a little bit from this, there are natural things. You have to make sure you maintain a very good feeding. Your enzyme activity have to be in check. I will have to treat enzyme activity later. So enzyme activity have to be checked. So most times I tell people that most of the food we eat, African foods or whatever, those things we actually been exposed to naturally sometimes affect our system, affect our hormones and the balance that is meant to be, so that the conception we seek for will come forward. So basically, I used to tell people increase your enzyme activity, and in doing that, I tell people it's not seen in most of the bitter leaf we eat, or ras soup we eat, or the okra and the rest of it that we are exposed to as Africans. I tell us that the natural way is to maintain your intake of vegetables. You see your carrot, you see all those vegetables that are there will go a long way. It has a lot of impact in your ovulation. You see your bananas, you see your egg, you see a lot of things. What you need is to understand the factors that you're supposed to put together to get this ovulation naturally done. And we are there to help you. So from there, we have to move down to the fertile window. You get? There are other combined factors you can do and still get this. So we are here to help you in those natural processes of conception that will help you. So you have to understand the fertile window. The fertile window is the time period a woman is most likely to conceive. Last is about most people, okay, Lastly, it's about 5 to 6. It lasts about 5 to 7 days. You talk about the wet period. You talk about the ovulation proper. You need to understand those period. You need to understand those timing. And then get the peak of your ovulation to be able to get even that of the sex selection. You'll be able to meet up with it. Okay, so it's a few days thing. Sometimes it happens between 48 hours or 24 hours, depending on the body system. But make sure that you don't miss out in that peak. Okay, so another one we need to understand is understanding the sperm transport and ejaculation. Okay, during the intercourse, sperm is ejaculated into the vagina. Okay, the journey through this very cervix, the sperm must navigate through the cervical mucus, which can either help or hinder the passage depending on its consistency. The consistency of a sperm can actually help the sperm state, the journey. Ability to be so much enriched, ability to be so much rich enough to actually continue with that very process. That consistency is equally needed. They are sending to that uterus. The sperm then travels up through the uterus towards the fallopian tubes. There are lots and lots of things that happens in that very period before what we call fertilization is being taking place or observed. So without wasting time, after talking about the ovulation, the fertile window, you need to understand the sperm transport, which you've a little bit explained. Then fertilization, meeting of egg and sperm. The meeting of egg and sperm at a particular moment brings forth this fertilization. If sperm gets to the fallopian tube, meet the right timing, and sperm cells on its own can actually result to those mitosis, those processes that is supposed to take place. The sperm can penetrate the egg, and the process of fertilization keys in immediately. Other processes that is supposed to take place for we to get what we want, the fertilization, the conception, and the rest of it comes in place. Then to understand it more, we'll treat it more in other topics, break it down. So you need to understand briefly that these are the things that you expect. Okay, you talk about implantation. The journey to the uterus, the zygote begins to divide and travel to fallopian tube towards the uterus. Understand that something we call implantation. There must be implantation once fertilization has taken place. From there, it moves directly to the uterus. And the signs of those implantation has to do with implantation bleeding. When the conception has taken place or fertilization has taken place, those processes, there are things we're expected to see, though it doesn't happen in every conception. It doesn't happen in every woman's body, but you see, we have something we call implantation bleeding. Sometimes it's dark, sometimes it's red, sometimes it's spots. It's spots for some days at that period. So those people who have tested positive to pregnancy, who seems they are already losing the baby, or they are worried because they are expecting the menses, they are not expecting fertilization, but bleeding is dropping. Gradually the person start worrying, this is not coming forth, my menses is not coming forth. Understand today there's something we call implantation bleeding, that process where implantation happens. Okay, the movement of that, the movement of those sperm and egg that has come in place, that has started dividing, and the rest of it trying to travel from the ovaries to the uterus. Those processes that travel, those processes that happen at that time. Okay, process that happen at that time. Okay, we'll go ahead. Okay, but you have to understand something more in this implantation. The journey of the uterus and the zygotes begins to divide and travel down to the fallopian tube towards the uterus. The attachment there is what I was trying to explain. Now, when there is an attachment, after 5 to 7 days, the zygote, now called a blastocyte, implants itself in the lining of the uterus, where it will continue to grow and develop. Do you understand? And it will keep on, as I explained. At that process, you might experience what we call implantation bleeding at that process. Okay, mind you, when you see it, as I have explained before, do not worry, it's natural. Understand that those processes are natural. Okay, we'll come down a little bit to those factors that enhance this conception. The timing. Okay, when we talk about timing in conception, or timing in we talk about timing. When we talk about timing as a factor that enhances conception, we have to understand that that period that we are having ovulation, or trying to take in, or trying to do anything, that we must understand that you must put 100% interest in your timing. You have to understand your body system. If you can't, there are a lot of people that can help you understand the timing, understand your system well, and give you the results you desire or you're eager for. Okay, timing there, I mean the timing of intercourse around the ovulation, is crucial for maximum or maximizing the chance of conception. You must understand your period. You must understand your menstrual cycle very well, understanding it in the sense that you must know if you're in short cycle or longer cycle. So be able to get your peak. At least be able to keep notes of your cycle when you saw that of maybe, let me take maybe July, August, September, you just keep once there's issue with conception, monitor your cycle by writing your menses when it drops. Once the bleeding drops, if it drops today and you didn't see it tomorrow, still counts today. If it drops today, you didn't see it in the morning, but you saw it in the afternoon or at the night, it's count it the second day. Just keep counting it until it keeps dropping. Last for 5 days, last for 3 days, last for 4 days, last for 5 days. We need to understand that those things happen. Please use your pen, be friend to your papers, draw your lines, put up the cycle for each month. You can actually write the experiences you get at the period, that today it came out 2 days, it was flowing so richly for 2 days, the third day you did not see anything at all, the next cycle you saw it for 1 day and you did not see again. Those things help us to actually diagnose you right and be able to give you the right treatment you desire, and try to put 1 or 2 factors. If there's some stress you pass through that month, you can put it down. Those are the things that help us in order to address the issues of timing. And mind you, the intercourse timing, I want us to understand is it must be close to the ovulation, must be close at the peak of the ovulation. That's for us to get what we want, because most of time the span life of XY chromosome and that of XX is not the same. So be able to understand your chances of getting conception that you want, for us to be able to manage you rightly. So you must understand that timing is so much very, very good factor to enhance your conception. Okay, we'll talk about the sperm health. Health of sperm are so essential for fertilization. It can actually hinder the health of any woman who wants to conceive. I've said it before, I've said it always. Like, I've actually made mention of every woman should understand that the predisposing factor of fertility, of fertilization, is the man's sperm cells. Most times people misunderstand in our culture per se that the woman is the one, that the predisposing factor is the woman. It's only the man being the head at that process. You have your eggs the eggs cannot conceive on its own. You really needed that your husband's sperm to activate the process of fertilization, so that there will be more life in your egg, so that it will bring forth to fetus that will result back to a being. Okay, so understand that the health of a sperm is very, very crucial. There are some sperm that are low. There are some sperm that their sizes and shape, it's so poor. There are some that the movement, the motility is so poor. There are some that is so associated, they're so poor as a result of infection. Untreated infection. It could be UTI on its own. It could be sexually transmitted disease. It could equally be as a result of certain trace elements or vitamins that is meant to be essential for the growth and the maintenance of sperm, and then is not rich enough. So we still need to understand that the sperm health is so much needed in order to maintain or enhance fertility. This conception we're talking about, again, the egg quality. A healthy egg with the correct genetic traits, the makeup, is also crucial for fertilization. Know that you have to understand that the egg, most times you see women, you go to ultrasound, the ultrasound sonographer is there telling you that look at, you did not ovulate last month. Look at your follicles are here. I'm thinking you're having PCOS, so I think you have to go for hormonal. Say you have to do this. It's just here. You needed extra help. Do you understand? So the egg quality is so crucial to maintain and get the answers we need. So understand that you need to take care of your egg. How do you know that your eggs are normal? Most times there are certain natural factors that I put up, I tell people to do, so that when that ovulation is coming normal as a woman, sometimes you feel the crapping along the waist. It could be the right ovaries, it could be the left ovaries. So those natural things I put up that you can actually do to be able to experience those natural ovulation, the ovulation proper naturally without using ultrasound to identify it. You feel it, and when it comes out, you see it. So those things, know that your egg quality is so crucial for you to be able to get a maintained answer that you need. And then at the same time, so that there won't be a breach in that contract when you've already conceived, alongside you start having bleedings or have miscarriages. So there are several factors you need to understand that enhances this conception. Your egg quality is another one to count there. Uterine environment. A healthy uterine lining is necessary for implantation to occur. When I talk about those uterine environment, when I talk about those, there are so many things. Your hormones are there first, but then infection. The several women who have staph, just like men as well, the vagina is so acidic that when conception starts keying in, the process have started, before you know it, the woman sees her menses again. It's either delayed, or after delaying for 1 week or so, it comes out again. Understand that the uterine environment is so essential as a factor to enhance your conception. So you must look at your infection level. Always make sure you go diagnosed and you get treated with the sensitive antibiotics that is being picked. Make sure that those environment is always kept clean. In so doing, I believe with this little points of mind that we will be able to get the answers we need. Understand these factors that enhances conception. Understand the natural processes of conception, which I've already tagged: the ovulation, the fertile window, the sperm transportation, the fertilization process itself, the zygote information there, the implantation, the detachment or attachment of those of the zygotes, and the division that is there. Understanding all this and help yourself as you're helping us to get the answers we want.